Greetings, fellow humans. Katrina here. Quick disclaimer, I'm a professional, not your professional. Nothing about this should be taken as medical, legal, otherwise advice. This podcast is purely for education and amusement. That is it. Disclaimer over. So I thought I'd talk a bit today about what I don't know about fentanyl. And I don't know a lot about fentanyl because I don't specialize in substance abuse. So what is fentanyl? Basically, it is a synthetic opioid that is 50 to 100 times stronger than morphine. If you've ever been in the hospital and had morphine, you know how strong that is. So pharmaceutical fentanyl was developed for pain management treatment of cancer patients, applied in a patch to the skin. Because of its powerful opioid properties, fentanyl is also diverted for abuse. Fentanyl is added to heroin to increase its potency or to be disguised as highly potent heroin. Many users believe that they are purchasing heroin and actually don't know that they are purchasing fentanyl, which often results in overdose deaths. So clandestinely produced fentanyl is primarily manufactured, according to this website, in Mexico. So the street names for fentanyl include a Pace, China Girl, Chinatown, China White, Dance Fever, Goodfellas, Great Bear, He-Man, Poison, and Tango and Cash. Lots of different words for it. And how it's used is it's like an intense short-term high, and you get temporary feelings of things like euphoria, slowed respiration, reduced blood pressure, and then you might have some nausea, fainting, seizures, and in some cases, death. Now, how it actually affects the body is kind of similar to other opioid analgesics. So the effects that fentanyl produces are relaxation, euphoria, pain relief, sedation, confusion, drowsiness, like I mentioned, dizziness, nausea, and vomiting, urinary retention, pupillary constriction, and respiratory depression. And that respiratory depression can be really problematic, especially if combined with other physiological depressants like alcohol. Just throwing that out there, that mixing alcohol with it would increase the chances of death, I imagine. And it says here that fentanyl is the single deadliest drug threat our nation has ever encountered. And that was said by an administrator named Ann Milgram at the Drug Enforcement Agency. Fentanyl is everywhere, from large metropolitan areas to rural America. No community is safe from this poison. We must take every opportunity to spread the word to prevent fentanyl-related overdose death and poisoning from claiming scores of American lives every day, is what she said. Now, according to the CDC, 107,375 people in the United States died of drug overdoses and drug poisonings in the 12-month period ending in January of 2022. Now, a staggering 67% of those deaths involved synthetic opioids like fentanyl. Some of these deaths were attributed to fentanyl mixed with other illicit drugs like cocaine, methamphetamine, and heroin, with many users unaware they're actually taking fentanyl. So things like cocaine and methamphetamine, if my understanding is correct, are stimulants, they're uppers. And so then somebody's combining that with fentanyl, a downer, and that can be extremely problematic on the nervous system and taxing on the body. It says here only 2 milligrams of fentanyl is considered a potentially lethal dose. And it's particularly dangerous for someone who does not have a tolerance to opioids. So let's say that a person doesn't use drugs on the regular, doesn't use opioids at least on the regular, and then all of a sudden thinks that they're getting methamphetamine and it's got fentanyl in it, and yeah, that would be a recipe for disaster. So in an effort to save lives, the DEA has joined the Song for Charlie, and it's a valued public health nonprofit. And so law enforcement partners are recognizing the National Fentanyl Awareness Day this year in 2023. It's going to be May 9th. And I think I saw somewhere May 10th was last year. I could be wrong on that. May 9th or 10th. But this day is an effort to educate individuals around the dangerous threat that fentanyl poses to the safety, health, and national security to the American people. And you'll notice this episode didn't come out on a May month only because I don't think it needs to be the awareness day to bring awareness to it. So yeah, to mark Fentanyl Awareness Day, the DEA released a video announcement from DEA Administrator Ann Milgram stressing the dangers of fentanyl and the need for urgent action. She says, "Please help us save lives by making sure you talk with your friends and family about the dangers of this deadly drug." And I think I mentioned that, I don't know if I mentioned this, that fentanyl is 50 times more potent than heroin and 100 times more potent than morphine, but it is. So it's inexpensive, it's widely available, and it's a highly addictive drug. So drug traffickers are increasingly mixing fentanyl with other stuff, whether it's in a powder or a pill, and this really drives addiction to create repeat customers. It doesn't make sense why they would be overdosing their customers by putting it in when they don't know. That doesn't make sense. But many people who are overdosing and dying, they just don't know that they're even taking fentanyl. They have no idea. That's sad. So the Centers for Disease Control and Prevention estimates that in the United States, like I said, it was over 100,000 people that died in 2021, and 66% of those were the synthetic opioids like fentanyl. Now, there's actually a place in the DEA museum, the Faces of Fentanyl, to really commemorate the lives that were lost from fentanyl poisoning. And so they have a thing where you can like submit a photo if you go to dea.gov, and you can like do their hashtag and all that good stuff. For more information on reading up yourself about the dangers of fentanyl, you can go to dea.gov/fentanyl awareness. So I hope you enjoyed today's episode. Remember to click the button on the website if you want to support the show. I appreciate each and every one of you. Be sure to tune in next week for more random information that may be entertaining and/or educational.